Private health firm Sciensus has failed to fix the defects that has led to UK patient deaths. I'm going to read into this exclusive from The Guardian, guys. Let's go. Good morning, good afternoon, good evening, wherever you are in the world. This is REGANELITE here with an exclusive from The Guardian, with the headline that private health firm Sciensus has failed to fix defects that have led to UK patient deaths. The exclusive reveals that regulators extends part suspension of license to July 2024 after IT blunder led to incorrect dosage of cancer treatments. So, because of obviously because of this private healthcare has clearly failed in its duties and responsibility of care here. Now, IT blunders can happen, but when we're talking about when it comes to a matter of dealing with patient care, this is quite a worrying thing to say the least. And we should be relying on our NHS, and more and more people are turning to private healthcare companies because of a failed national healthcare service, and people are paying into these private healthcares, and it makes you wonder how much care do they really care about their patients, doesn't it? Let's read into it, shall we? So a private health company paid millions by the NHS. So this is a company being paid by the NHS. Has failed to fix safety defects that have led to the death of a cancer patient, The Guardian can reveal. 3 patients were hospitalised and a 4th died when they were given the wrong doses of powerful chemotherapy drug after a catastrophic IT failure at the medicine manufacturing unit of Sciensus in April this year. I apologise, I can't say that word, Sciensus or Sciensus. I'm trying to pronounce it properly. The incident, first revealed by The Guardian in July, prompted an investigation by the Medicines and Healthcare Products Regulatory Agency, the MRHR. Its inspections found significant deficiencies at the Sciensus manufacturing facility and ordered the partial suspension of its manufacturing license. However, 6 months after the IT blunder, Sciensus has not fixed the problem identified by the regulator, according to people familiar with the matter. And as a result, the suspension of the license, originally due to be lifted last month, has been extended until July next year. Well, at least that's kind of potentially saved lives on that account. Sciensus is the UK's biggest provider of medicines to services to the NHS and private patients at home. It is contracted by the NHS and other organisations to deliver and administer medicines to more than 200,000 people with conditions such as health disease, diabetics, dementia, HIV and cancer. The partial suspension period has been extended for 9 months, and the MHRA's Inspection Action Group continues to oversee the company's work to resolve the identities deficits. A spokesperson for the MHRA told The Guardian. The initial license partial suspension period could only be for a maximum of 3 months, and as the definitions have not been fully resolved, the group recommended that the license should remain partially suspended. The suspension was issued in accordance with the Regulation 28 of the 2012 Human Medicine Regulations. This gives the MHRA the power to act when it appears to be in the interest of safety a company's license should be suspended. In a statement, Sciensus said it was working to resolve the problem. We want to assure all our patients that their medicines are safe, a spokesperson added. The revelations follows a series of articles in The Guardian exposing how patients were repeatedly put at serious risk and serious harm due to the botched provision of medicines by Sciensus. Sciensus gave the 4 patients unlicensed versions of Casabictal, a licensed chemotherapy medicine used to treat prostate cancer, according to people familiar with the matter. Casabictal is typically administered by drip into a patient's bloodstream. Sciensus is allowed to give certain patients unlicensed medicine when there is no licensed medicines that are available or capable of meeting their clinical needs. That's really scary. I would hope that they've had a long relationship to know that they are trustworthy, but I don't think that they are. The thing is that as much as I would love to say, oh, just let the NHS run everything, the problem is they can't. They can't. That's the problem, and we have to rely on private healthcare firms to do the work of the NHS. And we're paying this company because at the end of the day, we pay for the National Healthcare Service, which in turn is paying this company a lot of money, and they're not doing a good enough job. And it's very annoying to say the least. However, the unlicensed version of catastrophic was set up with the incorrect strength of the company's IT system. According to people familiar with the matter, the blunder resulted in 4 patients receiving the wrong dose. Blunders are... I will say that mistakes do happen with IT systems. But when it happens more than one occasion, that's when questions need to be asked. Like, what are you doing to make sure that these issues are fixed? If they're reoccurring, it means you're not resolving the issue, and that means you need to ask questions about this company and the way they're handling an issue such as this. It's easy for them to come out and say we take patient care very seriously when the Guardian is revealing that they still haven't resolved the issue here. And that's the crux of the whole point of all this, is that you say you're going to deal with it, but you haven't dealt with it. So what are you going to do to fix it? Our investigation and that of the company confirmed the issue were relating to specific elements of their IT system. A spokesperson for the MHRA had said the company needs to implement the necessary corrective actions to address the identity deficits before the suspensions can be lifted. Suspension, not suspensions. A Sciensus spokesperson has said the issue was contained to the setup of a small amount of new medicine, and there have been no new products set up on our system since the partial suspension was put in place. We will not be setting up new products until the MHRA completes their retrospection to their satisfaction. We continue to work closely with MHRA to resolve the issues to the agreed timescales and are confident that the suspension will be removed at the next re-inspection. The MHRA has refused a request from the Guardian for a copy of the report detailing its investigation into Sciensus. Why? You're looking after public health patients. Excuse me. We have a right to know that. The MHRA refrains from disclosing information relative to its inspections and investigations while it oversees the returns to compliance, a spokesperson from the MHRA says. This non-disclosure is based on an exemption in the 2000 Freedom of Information Act. We have a right to know because you are responsible for patients' care. Yeah, you're working for the National Healthcare Service. It's a public service. We have a right to know. It's extremely dodgy, to say the least. We have a right to know that. Sorry, I just knocked my mic there. In April, a Guardian investigation revealed serious and significant concerns among patients, clinicians and health groups about Sciensus. Subsequent articles have exposed how sick children and adults suffered avoidable harm as a result of failings by the company. In May, the Guardian disclosed that the chief executive of Sciensus, Darren Gibson, was warned 3 years ago that the company was putting patients at risk. Apologies if you hear fireworks in the background, I can't do anything about it. He was told in 2020 that patients are being left dangerously exposed to internal bleeding as a result of missing, incomplete or inaccurate deliveries. In June, the House of Lords Public Service Committee launched an inquiry into Sciensus and other private companies paid millions by the NHS to provide home care medicine services. Its final report is due later this month. They are managing, like, if they are completely separated from the NHS, then that's their choice whether to reveal the investigation. But because they're part of the National Healthcare Service, we should have a right to know the details of this. We should have a right to know, in my opinion. They're handling things that are part of a state of our National Healthcare Service. Now, I know I know the vast majority of the National Healthcare Service is privately owned. I know that. But we still have a right to know. We have a right to know why they're making these mess ups, and why they keep happening, and why are they still getting the same contract, and why are we not looking at someone else potentially to take it over if they're incapable of doing the job that they're being paid to do. They're playing with people's lives, and they need to make sure that they make sure to ensure that the health and safety of the patients that they are providing this for are looked after first and foremost. And clearly we've already had one patient's death that has clearly led to this, according to this exclusive. How many more lives are going to be before somebody wakes up? You know, that's somebody's life that could have been lost, that could have been avoided. Are we going to have to suffer more loss of life before people realise, hang on a minute, maybe we should not give these guys any, maybe we shouldn't review their licence? I mean, it's good that they're suspended at the moment, and I'm glad that is the case, but it still doesn't change the fact that they still haven't fixed the issues that they have. And I thank God we've got some barriers in our place to protect patients, but my God, like, I don't trust this company whatsoever when it comes to what they do, guys. But what do you guys think? What do you make of Sciensus? Their failures to fix defects from an IT blunder, as they say. How many more defects or blunders is it going to take for people to realise that maybe they're just not in the interest of the British public? Let me know down in the comments section below what you guys think. Like, share and subscribe as always. Thank you very much for watching, and I hope to catch you all very, very soon.